Okay, this video is called what abdomen diseases are caused by food. And it's a little bit of a joke because almost all of them are, all right? But I'm going to explain how it all works. First of all, just being fat, obesity. As Dr. McDougall had said, the higher the percentage of calories from fat that a population eats, the fatter they get. So that's why white rice, potatoes, sweet potatoes make people skinny because they only have 1% of calories from fat. Lentils have only 3% of calories from fat. The reason why fruits make people skinny is because fruits are very low in fat, okay? The reason why vegetables make people skinny is because they have such low caloric density. Caloric density is another good way to think of it. The reason why MSG makes people fat, like in the processed food, is because it tastes so good it makes them overeat the food. The reason why some of these preservatives cause people to gain weight is because they inhibit mitochondria, lowering your energy expenditure, and you gain weight, okay? The more processed food people eat, the fatter they get. All right, the next thing is abdominal pressure syndrome, and that was described by Dennis Burkitt. He was an Irish-trained physician. Then he did his surgery out in England. Then he went to Africa as a Christian missionary, and he discovered what was called abdominal pressure syndrome. Basically, the key thing about dietary fiber is it attracts water to the stool, so it makes the stool soft. The right side of the colon should be liquid stool. That's very important because if you have dried out stool on the right side of the colon, which is what you get when you eat processed food because it's low in fiber, or meat because it has no fiber, then you form dried out stool on the right side with little rocks, little pellets. They can form a lith. Lith means stone, fecalith, and the little stone can obstruct the appendix, hangs down like a pinky finger from the cecum, the right side of the colon, obstructing it. The mucus glands below continue to secrete mucus, and they can then stretch and pop the appendix. That's appendicitis, okay? Much, much more common in people who eat high amounts of processed food and meat. All right, the other thing is, because you don't have water in the stool, normal bowel movement, you guys, like a cow patty, and it's got a lot of bulk to it from the water attracted by the fiber. It stretches the rectal muscles. Your butt knows when you're home, and it's a safe time to have a number two. So when you sit down on the loo, there's a reflex contraction of the muscles in the rectum, and it's effortless. Versus if you have dried out stool from eating processed food and too much meat, then you got little goat pellets down there, and they don't stretch the rectal wall, so you don't get that reflex contraction, and you got to tighten up the abdominal muscles. That's a Valsalva maneuver, and that back pressure of the Valsalva maneuver gets transmitted into the abdomen. Transmitted into the sigmoid colon causes outpouching. That's diverticulosis. One of them pops. You leak stool into the mesenteric fat, abdominal fat. That's diverticulitis. Pushes the stomach up into the chest by going through the esophageal hiatus over and over, widens it. Part of the stomach pops into the chest. That's called hiatal hernia because it's going up through the esophageal hiatus. The connection between the diaphragm is a connection between the chest and the abdomen. The dividing line is the diaphragm. So when part of the stomach pops into the chest, that's called the hiatal hernia. It causes loosening of the lower esophageal sphincter between the esophagus and the stomach. Gastric acid refluxes up into that lower esophagus. That's called GERD, gastroesophageal reflux disease, GERD. Chronic inflammation in that location, hot disease, cold disease, fibrosis, tissue ischemia will lead to increased risk of cancer, esophageal cancer. It used to be smokers and drinkers would get smoker-drinker squamous cell cancer from direct irritation of the esophagus, but nowadays it's this indirect reflux that's leading to adenocarcinomas of the esophagus. Okay, the down pressure of Valsalva maneuver with abdominal pressure syndrome goes into the leg, varicose veins in the leg. Goes into the scrotum, varicoceles in the scrotum. Dilated veins in the scrotum, they heat up the testicles, they'll lower your testosterone, they'll lower your sperm production, infertility. So you can get infertility in a man from being constipated. Okay, back pressure down on the rectal veins of the rectum, hemorrhoids. You get more bleeding in your stool when you wipe your butt. Okay, you can even have significant bleeding from hemorrhoids. That's rare, but it can happen. All right, so that's pretty much it for abdominal pressure syndrome. And like, why am I going through all this? Because I'm telling you, MDs don't know this. I didn't know this stuff. 99% board scores, and I didn't know this stuff. I talked to surgeons. I've talked to surgeons who specialize in surgery of the colon, and they don't know abdominal pressure syndrome. That's how severely lacking is nutritional training for conventional MDs, okay? That colorectal surgeons don't know abdominal pressure syndrome. The people who deal with these diseases all day long, every day, they don't know abdominal pressure syndrome. That's how basically ignorant conventional medicine is. Okay, now we're going to talk about leaky gut. Leaky gut is primarily due to lack of dietary fiber, but it's also due to toxins. Just your tap water contains fluoride, Chlorine and aluminum. All of those damage the gut lining and predispose to leaky gut. Leaky gut just means increased intestinal permeability. Glyphosate, that herbicide sprayed on the non-organic food, that also irritates the gut lining, okay? Other things will do it. Excessive amounts of saturated fat from animal foods, oils from processed food, emulsifiers, carrageenan. All of these things irritate the intestinal lining and predispose to leaky gut. When you got leaky gut, you're going to get toxic things. Let me show you some pictures. It'll be better if I show you some pictures. Let me show you the pictures. Okay, here's just, oh, how did I get right to this idiopathic intracranial hypertension paper? I want you to see that, but not next. Okay, here's what you need to see next. So here's what all that stuff I was going through. I should have shown you the pictures first. Here's the hemorrhoids around the rectum. Here's the varicocele, dilated veins in the scrotum. You'll get gallstones in the gallbladder. That's part of Western abdomen syndrome. I'm going to get to that in a moment. Here's hiatal hernia, the stomach popping up into the chest, refluxing acid, getting esophagitis, leading to eventually Barrett's esophagus, a change in the mucosal lining of the esophagus, GERD, heartburn-like discomfort, pain from gastric reflux, gastroesophageal reflux, GERD, and then higher risk of esophageal cancer. Diverticulosis is the outpouchings. When it pops, that's diverticulitis. Here, let me get myself out of the way. So if you want to print screen this one, this is a good picture. You might want to print screen this. Let me get myself totally out of the way. All right, so that's kind of a cool picture. Yours truly, yes, I drew this. Pentacle lift, the mucus glands keep secreting, and then the appendix gets too big, it pops. That's appendicitis. Down pressure in the leg, varicose veins. Increased pressure on the hernia sites, inguinal hernia, periumbilical hernias, all this stuff's more common. All right, so that's the Dennis Burkitt abdominal pressure syndrome. I just drew in the gallstones here just because there's something else called Western abdomen. 95% of gallstones are due to cholesterol. So high-fat diets elevate blood cholesterol and they increase your risk of gallstones. Tons and tons of patients have gallstones. Most of them are asymptomatic, but if they block the cystic duct right here, they can cause acute cholecystitis, inflammation of the gallbladder. Rarely they can even block the common bile duct and cause jaundice. Okay. All right, now I'm just showing a couple more things here in what I would call Western abdomen syndrome, okay? So Western abdomen syndrome just means all the stuff we already talked about, Burkitt's abdominal pressure syndrome, but you also get fatty replacement of the liver. That's diabetes of the liver. You get fatty replacement of the pancreas. That's diabetes of the pancreas. That's why you want to reverse diabetes, the sooner the better. Fatty liver initially is completely reversible. You might call it NAFL, non-alcoholic fatty liver. That's reversible, but it'll proceed to NASH, non-alcoholic steatohepatitis, where there's inflammation. Itis means inflammation. And the more that goes on, you start getting fibrosis, cirrhosis. That's not so easily reversible, okay? Fatty replacement of the pancreas, not good. That's what you see with the type 2 diabetics. You trash all the pancreas and it's atrophic and replaced by fat. Now you can't make enough insulin. You'll never be cured of diabetes. You're always going to be insulin dependent the rest of your life. Versus if you go low-fat vegan, you lose the weight. You cure type 2 diabetes very easily initially. Same patients always have calcifications of the coronary arteries. I don't have it drawn on here, but they also get degenerative disc disease of their entire lumbar spine. I see these things, by the way, all day long, every day. These diseases are so common that they're considered normal aging, okay, in the Western world. Whereas you get people from other countries. I got guys from countries where they still eat a lot of plant foods, and he tells me, we don't have any diverticulosis in my country. Also, the same diet, the high-fat, high-meat diets produce more kidney stones. Oxalate stones are relatively uncommon because all these people say, what about oxalate stones? What about oxalate stones? Let me tell you something. I've had some days where I see 20 kidney stone patients in one day, and 19 out of the 20 will have a fatty liver, okay, from eating processed food and animal foods, okay? Here's the abdominal aorta. You get atherosclerosis calcifications. This is just a reminder. They'll often have little AAAs, abdominal aortic aneurysms. The arteries, like the lumbar arteries, run mid-height of the lumbar vertebral bodies, and as they become ischemic, filled with atherosclerosis or occluded, they will narrow the blood flow to the spine, and you get degeneration of the disc. Then you start getting all that stuff that goes with it. Diffuse idiopathic skeletal hyperostosis, DISH, OLF, ossification along a ligamentum flavum, OPLL, ossification of posterior longitudinal ligament. Then you get ossification and fusion of the spinous processes. That's called Bostrop's disease. Anyways, this is the Western abdomen. These things are so common, we just take it for granted. When you get asymmetric disc-based narrowing, like this disc is more narrow on this side than this side, that produces a type of scoliosis that's acquired. It's called degenerative scoliosis. I see this all day long, every day. This is like, this stuff is so common, okay? And tons of people have kidney stones that just haven't become symptomatic yet. Tons of them. We call it nephrolithiasis. Okay, so that's Western abdomen syndrome. I'm the one who made up that name, by the way, Western abdomen syndrome. Okay, abdominal pressure syndrome made up by Dennis Burkitt. Dr. McDougall is famous for the quotes, "The fat you eat's the fat you wear." And the higher the percentage of calories and fat in your diet, the fatter the population. McDougall figured that out. Okay? Nathan Pritikin figured out all fat is bad. It all makes you sick. It's all atherogenic. You know, David Blankenhorn helped figure that out as well. Okay? Fat is bad is what Nathan Pritikin said. Okay, this leaky gut stuff, I'm not sure who figured it out. I learned it from Dr. McDougall, and then I just read about it in more detail. I can tell you the people who figured out amyloid clotting are Douglas Kell, the PhD from England, and Etheresia Pretorius. She is the PhD lady from South Africa. Okay, I'll show you that. I'll show you what amyloid clotting is about. This is what I was just talking about, Western abdomen syndrome. I'm the one who described that, and then I'll go into a few other things. So, here's leaky gut. I should have shown you this right away. Sorry I didn't go right to the pictures. So here's a picture of leaky gut. And basically the dietary fiber is taken by the good bacteria. There's only two types of gut bacteria, good bacteria and bad bacteria. Don't worry about all the names, that's not going to help you. Good bacteria, they take the fiber, they convert it to short-chain fatty acids, in particular butyrate. Butyrate's a 4-carbon fatty acid. Carboxylic acid, like butanoic acid. Taken up by the gut lining cells called enterocytes. They convert it into tight junctions. The tight junctions are a block. These little red tight junctions. That's what TJ for, tight junction. And they prevent bad stuff from getting across the bowel lining. If you don't have intact tight junctions, then you get bacterial endotoxins, LPS from gram-negative bacteria. That's lipopolysaccharide. It's also called the other version of it with gram-positive bacteria. It's going to be LTA, lipoteichoic acid. Okay, that's LTA. When that gets across, it causes tons of inflammation in the body, and it causes something called amyloid clotting in the blood. You'll also get big chunks of protein getting across the gut lining, and those can confuse your immune system. You get something called molecular mimicry with autoantibody cross-reactivity. So what that means is, if you think about a hot dog is basically like an animal in a blender, you know, a pig in a blender, okay? And you blend the whole thing up, including thyroid, for example. And then the immune system reacts to the thyroid. Because it's coming from a mammal, it's close enough to our own thyroid, it'll then cross-react with our own thyroid sometimes. That's Hashimoto thyroiditis, most common cause of thyroiditis. Next most common would be something like Graves' disease, thyrotoxicosis, okay? And all of the autoimmune disease. It's the most common cause of autoimmune disease. Multiple sclerosis, lupus, etc. There's other things that can cause autoimmune disease, but that's the major one, leaky gut. PAMPS just means pathogen-associated molecular pattern, okay? All right, so here's other things that cause leaky gut. We talked about the stuff in tap water, non-steroidal anti-inflammatory drugs, aspirin, high fructose corn syrup, non-organic corn, BT corn, polysorbate, another one of these processed food chemicals, artificial sweeteners can do it, HG from your silver filling amalgams, chemotherapy, traumatic brain injury, corticosteroids, titanium dioxide, a lot of stuff can cause leaky gut, okay? Alcohol will do it. You want to be drinking alcohol. No alcohol, not one drop. And the reason I want to show you this is a lot of people think, well, I'll go to my doctor. My doctor's the expert. Oh, BS. Endocrinologists, rheumatologists, they don't know how to treat these diseases. I just show you this lady, Jacqueline Dupre. She was like the greatest cellist player in the whole world. Her husband was Daniel Barenboim, one of those most famous musicians in the world. She got multiple sclerosis. They couldn't do a darn thing, and she died pretty fast, okay? And what I'm trying to tell you is Roy Swank put in all these people on a low-fat, primarily plant-based diet, and he's got people, 95% of his early diagnosed MS, they're fine at, 32 years later. What I'm trying to say is the low-fat vegan diet is much more powerful than conventional doctors. You want to know that because nobody's going to tell you. Conventional doctors don't know that. All right, I'm going to also tell you something. This was a sad thing in my life. I had a high school girlfriend who was a magnificent musician. She was a world-class professional musician, went to Juilliard. Her mother had lupus, and I felt bad. At the time, I was just a young guy. I was in med school, and they asked me, what do you do? I don't know what to do. It doesn't matter how good a student you are. All you know when you're that young is you just say, go to the specialist. So she went to the best specialist. and she had a terrible outcome from lupus. She died, miserable death. Okay, and I felt bad. I didn't know all this stuff. I didn't learn all this stuff till I was done with all my training and I was out in practice for over a decade. So I wish I would have known. I could have maybe saved her. I could have maybe saved my mother. I could have maybe saved my father. I could have maybe saved a lot of friends of mine. But I didn't know. That's partly what pissed me off. I worked so hard, gave up my whole entire life, and these bastards kept it hidden from me. Okay, I had to find it out on my own after I got fat in my early 30s, and I started reading through all the literature, and I'm like, holy crap, all these diseases are curable. Nobody frickin' told me. Okay, so here is amyloid clotting. Basically, leaky gut, you get gram-negative bacteria-related LPS in the blood, lipopolysaccharide, gram-positive related LTA, lipoteichoic acid, and they cause a transformation of the shape of fibrinogen. Fibrinogen is a blood clotting protein. Normally it's like an alpha helix, a cylinder, but when exposed to these endotoxins, it changes, becomes flat. It's called a beta-pleated sheet, secondary protein structure. You can look that up in any biochemistry book. This change from alpha helix to beta-pleated sheet, that's called an amyloid transformation. Free iron in the blood can do it too. A lot of processed food is fortified with iron. Lots of meat, like red meat, for example, has got lots of iron, and it's higher absorbed heme iron compared to plant iron. So people eating a lot of meat and a lot of processed food become iron overloaded. Men in their 20s, women after they're postmenopausal. And they get increased rates of this amyloid transformation, blood clotting, which increases the risk of all diseases related to blood clotting, including stroke, including heart attack, atrial fibrillation, congestive heart failure, and dementia. Okay? So you want to prevent leaky gut. All right, here's the two, Etheresia praetoris from South Africa, Douglas Kell from England. These two are geniuses. They deserve Nobel Prizes, maybe 2 Nobel Prizes. They're never going to get anything. They're never going to be in the books because nobody's going to make money off this, okay? If what you figure out, you can save 10 million lives. Nobody gives a shit. You can save 0 lives but make money for a corporation. You'll be in the books. You'll win a Nobel Prize. They're all corrupt. The Nobel Prizes and the conventional medical books are corrupt. This is just showing the increase in iron in the blood of a man in the Western country. The reason we sequester free iron is because it enables bacteria to grow and to prevent all these reactions of ferrous redox cycling. Okay, okay, we're not going to get into that more. Just one point is, what I'm telling you is always the same. Wherever they eat the old-fashioned plant-based diet, they're not going to be 100%, but they're going to be 90-95% plant-based approximately. They don't get any of the Western diseases, any of the Western abdomen stuff. They don't get any of this stuff. All right, they don't have like next to 0 autoimmune disease, 0 hypertension, 0 diabetes, 0 coronary artery disease, okay? Classic example, one of them we talk about often is Tarahumara in northern Mexico versus the Pima, former Mexicans absorbed into Arizona, now eating the sad diet. It's always the same. You take the healthy Asians, you migrate them to Hawaii, it gets worse. You migrate them to California. The more Western their diet, the sicker and fatter they get. It's always the same. So we won't talk about that anymore at the moment. Okay, so we went through a lot of stuff, but there's one last one that I think is a little bit interesting. Now, this is not that common, but it's good to know. Big fat belly, and this is, I'm going to show you now what idiopathic intracranial hypertension is all about. It's more common in women, but basically a big fat belly pushes back on the inferior vena cava. That's the big vein in the abdomen, drains blood to the heart. RA is right atrium, okay? This big fat belly pushing on the inferior vena cava exerts pressure on the right atrium, exerts pressure on the superior vena cava. So you get elevated central venous pressure. And now that superior vena cava causes increased pressure going into the brain. This is called idiopathic intracranial hypertension. And you start seeing things. You get increased force of the CSF pulsation cycle, and it starts pushing down into the cella turcica where the pituitary gland is housed, the endocrine gland. And you start getting fluid around the pituitary, and you smush down the top of the pituitary. That's called partially empty cella. Here's a more advanced empty cella. That's one manifestation of idiopathic intracranial hypertension. Now, don't get me wrong. This is more, when we're talking about this, we're talking about in reproductive age females, premenopausal females primarily. Okay, men will often have a tiny little pituitary. That's why men have a relatively fixed emotional affect. We don't have that big an emotional range compared to females. They're all over the place. One day she's crying, the next day she's stomping her feet, throwing a shoe at you. Their emotional effect is all over the place. They got this giant pituitary that waxes and wanes with their menstrual cycle. From across the room, by the way, I've seen over hundreds of thousands of brain MRIs and CTs. The only obvious difference is big honking pituitary in the premenopausal female. Okay, it'll have this big convex upperward surface, whereas a male pituitary often looks like this. Even in relatively young males, they don't have much of a pituitary compared to females. Nothing compared to females. Okay, now here is an idiopathic intracranial hypertension patient. They got empty sella. They got dilation of the CSF sheath around the optic nerves. Cranial nerve 2. You got a little bit of a bulge of the optic disc from the fovea, the macula, the highest resolution area where the optic nerve connects. Okay, here you got inverted optic disc bulging into the eyeball. You got flattening of the transverse sinus on both sides. That's a time of flight magnetic resonance venogram. Contrast is better, like a coronal T1 MPR, but multiplanar rage sequence. But still, a loss of the transverse sinus is bilateral. If you only lose them one side, that's probably a normal variant. I see that all day long, every day. But if you lose it both sides, then that's good for idiopathic intracranial hypertension. And these patients, can have visual loss from increased pressure on their optic nerve, on their retina. They can get the pressure grinding into the skull base, get these little meningocele things. You'll see these little erosions. Sometimes the arachnoid granulations will be doing this. You get these erosions in the skull base. These are characteristic findings. Little meningoceles bulging down into the temporal bone. Okay, normally you don't have that. This is just showing dilation of the CSF space around the optic nerve again in the in the sagittal view. Okay, here's the axial view, and you can see there's a little bit of a hypertrophy of the optic disc. You usually don't see it that well. Here it is with IV contrast, enhancing and bulging forward, whereas normal it's all flat back here. Okay, here it is enhancing, all right? And then I just show you this one last slide that this idiopathic intracranial hypertension exerts pressure into the cranial nerves and the spinal nerves, and it can cause waxing and waning pain all over the place, including different spots in the back and whatnot. And this is one of the theories as contributing to fibromyalgia. So a lot of these people, these fat patients, these autoimmune patients, what they need to do is start eating a low-fat plant-based diet, organic only, to prevent leaky gut, and then they're going to optimize their body weight, and then most of the stuff goes away if you catch it soon enough. The more chronic a disease is, the more you start getting irreversible damage to the tissue, and it might never be reversible. But I wanted to show you this is what a tremendous, huge number of disease could be cured. And the other point is, when you do this, don't be a stupid, half-assed, typical patient. Go balls to the wall, 100%. Follow it as much as you can. That way you can figure out if it works or not. Try it for 3 months. If you just half-ass it, you don't know if it didn't work or if it just didn't work because you half-assed it. But in my experience, most people half-ass it. That's a sign of low intelligence. You want to go 100% and try to fix your problem by just changing your diet and lifestyle, because if you can cure yourself, you cure yourself, and you don't spend any money and you don't take any risk. Once you start going down the path of medications, you cause all these secondary problems, and it's hard to figure out what's coming from the food, what's coming from the medication, or what. You complicate yourself, and you run the risk of destroying your internal organs, like losing your pancreatic function, so then you have irreversible type 2 diabetes, rather than just going low-fat vegan and curing yourself in the first place and being done with it like a smart person. Anyways, I hope you found that helpful.